So good afternoon, everybody, and welcome to this webinar. It's called The Chemical Pollution and Men's Health, Evidence, Policy Gaps, and the Path for Prevention. And I'm really excited because this is co-hosted by the Health and Environment Alliance, also known as HEAL, and the Association of the European Cancer Leagues, also known as ECL, and one of HEAL's member organizations. My name is Janan Jensen, and I'm the Executive Director of HEAL. And I'm super excited to moderate this webinar today on a very important issue, which we hope is going to help fill the gap about how pollution impacts people's health. So the webinar today will firstly focus on a new report that HEAL commissioned, which highlights how chemical pollution is fueling a growing men's health crisis in Europe. Rates of prostate and testicular cancer, as well as male infertility, continue to rise. And there's evidence that links these trends to exposure to harmful chemicals, such as phthalates, PFAS, pesticides, and microplastics, to name a few. We're really pleased that we launched the report in November, just a few weeks ago, and we have registered this event as a Movember event. And for those of you who might know, Movember is a campaign, a global campaign, with aims to raise awareness on and improve men's health, particularly prostate and testicular cancer, as well as mental health, and fundraise for prevention efforts. So our aim in this webinar and report is to bring together experts and leaders who can be advocates to unpack what these findings mean for public health, and to use this evidence that we're going to hear today for EU's chemical regulations, such as the REACH revision or a far-reaching PFAS restriction, so that the EU can actually better protect men's health for generations to come and prevent diseases. So with that, I would like to introduce our first speaker, and that's the report's author, Dr. Rosella Canarella. She is an endocrinologist specialist and clinical andrologist. She's a clinical researcher in male reproduction at the University of Catania in Italy. And really exciting, she also holds the chair of the Endocrine Disrupting Chemicals, EDC, Special Interest Group of the Endocrine Society. And she's a member of the Men's Health Steering Group of the same society. So with that, I would like to give the floor to Dr. Canarella and give her the moment to present the report, and then we will move on to the second speaker.
So, hello everyone. It's really such a pleasure for me to have the opportunity to present this report. And before moving forward, I would just like to say that as a clinical andrologist, we really deal, of course, with men's health, male infertility, prostate cancer, testis cancer, and we can really say that there is a kind of hidden crisis because men's health is such a neglected topic. And so I'm really glad to have the chance to present these findings that may help to influence policy making and try to cover this really important topic. So this is basically how globally the report looks like. So there is an executive summary that highlight basically the main part, basically message. So the key message of the report. Then there is another section that is focused on what are the most important chemicals that we need to look in EU countries and what are their consequences on specifically men's health. what are the health outcomes that we are looking on specifically, and the report covers the issues related to prostate cancer, testicular cancer, male infertility, hypogonadism, that is related to low testosterone levels, sexual function, and something that is very interesting is intergenerational health. Another aspect that is covered regard the epidemiological, burden of this disease, as well as the economic cost, because to understand the sides from both an epidemiological point of view and also from an economic point of view, it's important to understand what we are talking of, and so the impact that policy making has on all of this. And then we will complete with the policy implications that comes from this report. So first of all, how the report was made. So basically, as it is usually done for scientific review studies, I based my review on scientific, data sets like PubMed, like Scopus, and these basically are data sets that include scientific studies. And so I based my review on those, looking for specific key terms that could help me to prioritize the studies. So I use key terms like chemicals, like bisphenol, like prostate cancer, testis cancer, and so on. I prioritize the EU court-based studies, and I also reviewed the reference list from the selected studies to avoid misevidence, basically. Also, regarding the epidemiological part of the report, this is based on the European Cancer Information System that provides update EU epidemiological data. So the report provides update, evidence concerning the epidemiological section. So let's start with these chemicals. I mean, what are we talking of? So from this section on, we will understand what are the main chemicals that can affect testicular function and men's health. But first of all, we need to understand that there are specific window of exposure that are related to a different and more harmful effect. Specifically, if the exposure happens basically in prenatal life, this can lead to long-term and non-reversible consequences. This is very important, because during prenatal life, what happens is that the testis is in a developmental phase. Therefore, if this developmental phase is disrupted by chemicals, the consequences are non-reversible. And some of these are the so-called cryptorchidism, which is a disease of the alteration of the descent of the testis into the scrotum, and this is associated with infertility and also exposed to testicular cancer risk. Hypospadias, this is a malformation of the urinary tract, and altered testicular function. Exposure is associated with a higher risk to develop infertility and reduce sperm count. And again, this is not reversible. So this is very important. In the same way, exposure that is early in life, so during early postnatal life and during childhood, exposed to an alteration in testicular function that is associated with non-reversible infertility later in life. Of course, malformation are not the consequences of this specific exposure, since the genital apparatus postnatally has already been developed. But infertility is another aspect that is associated with this kind of exposure. And finally, the exposure in adulthood is associated with abnormal and altered semen quality, testosterone production, and of course, cancer susceptibility. So let's start with now an overview of the chemicals that can impact negatively on men's health. Let's start with the endocrine disruptors or endocrine disrupting chemicals. These are, a group of chemicals that basically act by interfering with the hormonal function. So with, for example, the effect that testosterone or estradiol physiologically have on prostate, on testes, on fertility, and so on. So they act through this mechanism. Some of these endocrine disruptor chemicals are called phthalates. These are very important, and what I would like you to know is that they are really ubiquitously present in the environment where we live, because they are used as plasticizers in PVC. They are used to make cosmetics. They are used to make ultra-processed food. They're used in packaging and also in medical device. So we are really heavily exposed to these chemicals. Now, according to a biomonitoring study that has collected evidence from as high as 17 EU countries, basically the study demonstrated that using more than 4,000 individuals, and many of these were kids or mothers during pregnant life, so these are really sensitive age groups. The levels in the urine of phthalate were above the health-based guidance values. So this is alarming, of course, because we know that phthalate is a chemical that impacts health in general, but focusing specifically on men's health, it is associated with a reduction of sperm quality and a reduction in testosterone levels. Lower testosterone levels in turn predispose the patient to risk for diabetes, for heart disease, for stroke. So we are talking of something that really impacts the health of a subject. Another chemical that is included among the group of EDC endocrine disruptors is the bisphenol. Again, this is used to make food containers, thermal paper, consumer goods. So again, we are really heavily exposed to this chemical as well. And another biomonitoring study, the Human Biomonitoring for Europe, using a really importantly, high-sized cohort from EU, found that basically all the individuals that were enrolled, and they were thousands, were all exposed to bisphenol. Again, bisphenol is associated with a reduction in sperm concentration and an alteration also in testosterone level. Even pesticides, and that we know again are present, of course, even in the food that we eat, are associated with a decline in sperm concentration and even in testosterone level. Moving to PFAS, so what are these chemicals? These are called forever chemicals because these are extremely persistent in the environment. They are present in waterproof coatings, non-stick cookware, and firefighting foams. According to a Flemish study, again on thousands of people, and these people were many of sensitive ages like kids, adolescents, or even adults in reproductive age, basically over 95% of people was exposed to PFAS. So again, we are really heavily exposed in Europe to this chemical. And again, this is associated with an alteration in the hormonal levels that are important for the start of puberty. They're associated with a reduction in sperm quality and a reduction in testosterone levels. Even heavy metals like lead, cadmium, mercurium are associated with a reduction in sperm count and in testosterone levels. You can read here epigenetics. This is something that we will come to. And this is important because an abnormality in epigenetics can represent the mechanism through which there is a transgenerational impact. What does it mean? Basically, that if the father is exposed to a chemical, he will have an abnormality in the sperm that is transmitted to the offspring. And therefore, even the son or daughter will be exposed to a higher risk of developing specific disorders through the exposure that is not in the offspring, but in the father. So we are talking of something that has implication not only in the people, in the person that are exposed, but also in the next generation. So if you think at the impact, socio-economical impact, for example, this is very huge. Coming to micro and nanoplastic, this is a kind of emerging, finding. Evidence has shown that microplastics are present in reproductive organs, and particularly in semen sample, there are microplastics that are associated with an alteration of sperm quality and sperm function. Microplastics are able to determine infertility, altering the sperm quality themselves, but also because they act like a kind of Trojan horse, meaning that they can carry other endocrine disruptors, and so they can, be more toxic for the negative action that they display themselves, plus for the action exerted by the other chemical. Another issue is called cocktail effect. So we are simultaneously exposed to many chemicals, and this concomitant exposure basically act in a synergistic way, impacting in a negative manner and heavily both the sperm and testosterone levels. Now, let's look the health outcomes in men. So, prostate cancer is something that has an epidemiology that is increasing over time. So basically, what we know is that prostate cancer is the third most diagnosed cancer in EU countries, with an incidence of over 150 cases for 100,000 men and a mortality rate of 40 per 100,000 men. So this is very important on a epidemiological point of view. What is interesting to note is the relationship between exposure to chemicals and the etiology of prostate cancer. First of all, because prostate cells themselves express receptor for hormones, so receptors for testosterone and for estradiol, and therefore the endocrine disruptors are capable of interfering with these hormones, and this is something that disrupts prostate cell physiology. Secondly, the study have already observed and proved basically that some chemicals like bisphenol, cadmium, etc., can influence and can cause actually proliferation of the cancer, the prostate cancer cells. So basically, this link and points toward a causal effect between the exposure and the etiology of the cancer itself. And further confirming this, looking at EU studies, basically patients that were exposed to pesticides or to PFAS had a greater prevalence or risk of developing prostate cancer compared to unexposed people. So this is very important because, again, points toward a link, a causative link between ADC and chemical exposure and the prostate cancer onset. Testicular cancer is the most common cancer in Europe. Europe is the place with the highest prevalence of testicular cancer in the world, and specifically Northern EU countries have the highest incidence rate among EU countries. What has been already shown, and there is a high level of evidence that confirm and demonstrate and support this, is that maternal exposure to specific chemicals, phthalate, BPA, pesticides, PFAS, etc., basically is associated with an alteration of the testicular development in fetal life, and this basically predisposes the testis later in life to infertility, to abnormalities in the development that in turn associate with the development of testicular cancer. So basically, the increased prevalence of testicular cancer in EU is associated with a greater exposure of mother to these chemicals that we are reviewing in this slide. And again, this is very impactful and important. Coming to this chapter, testicular function. So here you can see sperm count, testosterone, erectile dysfunction. So if we talk of sperm count, I think many of you have heard that there has been a decline in sperm count worldwide. And basically in the last 40 years, the sperm count has halved. So this means that there has been a decline by 52%. This has been recognized worldwide, but in Europe, the trend is exactly the same. And the studies that have been performed in EU courts basically have linked the exposure to specific chemicals like phthalate and BPA to this kind of decline. Regarding testosterone, again, the prevalence of hypogonadism, which means low testosterone levels, that is something that clinically impact on the health of the patient, promoting diabetes, promoting cardiovascular disease, osteoporosis, depression as well, and erectile dysfunction. So a biomonitoring study, so that has collected a really huge number of individuals, has observed the presence of an inverse association between urinary phthalate concentration and testosterone. This means that the higher was the level of phthalates in urine, the lower were the level of testosterone. Transgenerational effects, this is something very important, also because literature is starting to demonstrating that, sperm is not just a carrier of paternal DNA, but it also is a carrier of RNA and, in general, molecules that are capable of influencing not only the embryo development, but even the offspring health. This is evidence that is starting to be, more and more published in current literature. And if we relate, the transgenerational impact of the sperm to exposure to endocrine disruptors, a few reports have found basically that the exposure during the pre-conceptional window, so from 15 to 69 days before conception, exposure to air pollutants is associated with shorter gestational age, greater risk of fetal growth restriction, so to worse health outcomes during the birth. We don't have the outcomes in long-term life because the evidence is not still available, but there will be likely something because of this evidence. So regarding the epidemiology, I already mentioned something. I want just to tell you that in the report, there are several tables that in a detailed manner report basically the mortality and the incidence associated with prostate cancer, testis cancer for each EU country, and also the evidence on the prevalence of hypogonadism, infertility, and so you can appreciate the high prevalence of all diseases in Europe. Regarding the cost, so when we consider this chapter, we need to consider that the cost of the disease are, of course, direct. So they depend basically on the treatment and the money basically that it is needed to treat the patient. But there are also indirect costs. And if we consider, for example, the infertility chapter, this is something that has really an impactful meaning, because an infertile man can develop depression, can increase the number of absences from work, in general is less effective at work. And there are a lot of reports justifying this. If we look at direct cost, according to the ESHRE, which is the European Society for Human Reproduction and Embryology, basically the cost for infertility treatment range from 6 to 9 billion annually, and it has been demonstrated, has been reported that the exposure to EDC associates with almost 15 billion annual cost in EU for infertility. Regarding prostate cancer, you can see in the slides, the impact of the disease that is different based on the fact that we consider the treatment itself for specific stages of the disease or the treatment associated to the survival until death of the patient. So we are talking of something that really impacts on the economics, and this justifies the importance of using the rich revision opportunity to change the policy and therefore to influence the health basically of EU people. So basically there are gaps in current chemical regulation, and you can read those in these slides. For example, there is a lack of recognition of the importance of the so-called mixture effect or cocktail effect. So it is important to introduce something that somehow can consider the simultaneous exposure to more chemical. Another aspect is that there is a lack of consideration itself for the men's health. Basically, other vulnerable groups are considered, but coming to the outcomes of men's health, there is a lack of consideration, and this needs to be included also in view of the epidemiological weight of these diseases. It is important also to cancel vulnerable life stages. So, for example, fetal life, pre-conceptional life, and also kids coming to pre-conceptional life. There is more awareness or peri-conceptional life. There is more awareness in women but this is a totally neglected topic in men, but evidence is starting to claim that it is important to do the same in male as well. And also, it is important to, to accelerate the identification and the restriction of endocrine disruptors. So this is what I have. I'm happy, and these are the link basically to all the translations of the report. So thank you for the attention, and I'm happy to take any question later on.
Thank you very much, Dr. Canarola. It was a super clear presentation of what's in the report, very alarming and worrying on many fronts. Here, we did a report in, I think it was 2007, just on male fertility and chemicals. And now with this newest report looking at all the testicular cancer, prostate cancer, the cost, and the growing evidence that it exists. I think it's really important that we use this to look at how we can have different policies that can prevent exposure. And so one thing that I think is quite hopeful, so I want to tell people, if you have questions, please, I didn't say this at the beginning, do put them in the question and answer box at the bottom of the Zoom screen, and we will get to them after our second speaker. And I think what is really hope is that, a lot of the cancer groups are taking this public policy prevention on environmental factors much more seriously. We're going to hear just in a moment from Dr. Wolfgang on this issue. We also heard from the Global Action on Men's Health last week during the European Cancer Organization. They had a workshop on men's health and cancer. And they looked at how pollution could also be incorporated in their efforts. So, I mean, this gives me some hope that there is more stakeholders interested in using the public opportunities we have on policies at the EU level. So thank you again, and I will now introduce our second speaker. His name is Dr. Wolfgang Fecke. He's the Executive Director of the Association of European Cancer Leagues, and he is going to share their work on cancer prevention and PFAS exposure, and what they're doing to keep the EU action on cancer high on the political agenda. It's been several years since they become a member of HEAL, and we've been really excited to be working with them over the years. So thank you for being with us, and let's hear about your EU-wide action on cancer and a PFAS-free future.
Thank you very much, Shinon. So I hope that you can see my slides. I would first like to tell you a little bit about ECL itself. So we are an umbrella organization. We represent 35 cancer societies, national cancer societies in 28 European countries, also outside the EU. And we really look at the whole cancer continuum here. It's not only prevention, which we focus on in this webinar, but also cancer treatment, access to medicines, and cancer care for patients. Important also to understand is that we will not accept any support, any financial support from industries which produce products which are harmful or cancerogenic. This should be, of course, clear. Right now, cancer is the second leading cause of death in Europe. Cancer cases are rising. We have heard that before also in the first talk. And by 2035, everything indicates that cancer will be the leading cause of death in all of Europe. And it's already the case in several countries. So to really do something about it, we have several initiatives, and one of them is really a group of MEPs called MEPs Against Cancer, or MAC, which we often use to really highlight issues and highlight also the need for change in current policies. So The current topic here for chemical pollution, which can cause cancer, is an excellent example for that. And we have done that also earlier this year. The map which are involved here, there are about 30 coming from different political parties, and they are really helpful in really making sure that these issues are addressed. Yeah, so if we look at prevention and look at the different risk factors which can cause cancer, of course, number one will always be tobacco, and we are very active here, but there are several other important risk factors, and besides alcohol or other unhealthy diets, ultra-processed food, and so on, there are several risk factors coming from the environment. And apart from UV radiation or air pollution, there is the growing problem of harmful chemicals, and we have heard a lot of them also in the previous talk. So this is an area, a growing area where we are really should be all concerned with. And you might be aware of Europe's Beating Cancer Plan, which was initiated in 2021 and will run until about 2028 or 30. In that plan, there are several activities and initiatives, actions, projects which look at the exposure of chemicals and of radiation and the effects on people's health. And I don't want to go into details here. I just listed them here on the slide. But important to understand also that there is a partnership on the assessment of risks from chemicals to really make sure that these issues are properly addressed. So what are now the different factors coming from the environment? We, of course, have UV exposure as the primary risk factor for skin cancer. There's air pollution, radon as a gas which is naturally occurring, of course, in many areas. But then there are the man-made risk factors. A lot of them are already well understood carcinogens, others are pesticides, and we also heard in the previous talk about endocrine disrupting chemicals. So one particular factor which is also maybe worth keeping in mind, that if we look at work-related deaths which occur in the EU, about half of them are really caused by chemicals, by cancer-causing substances. So this is a big problem, and I would now like to show you an example also what we have done in that respect. But first of all, let's look a bit more into PFAS. So that abbreviation stands for polyfluoroalkyl substances, and you see a typical example here on the top right. So these chemical bonds between fluor and carbons, they are very stable, and they are responsible for the extreme duration of these substances in the environment. That's why they are also called forever chemicals. And they were introduced about 50 or even more years ago. Teflon is probably something which everybody heard about. And these chemicals are often used when it comes to protecting material. They are resistant against heat, oil, everything. They are in many textiles. They are in paint, furniture, cosmetics, and so on. The problem with these chemicals is that because they are so stable, they accumulate in the body. So animals take them up. Um, by eating these animals, by drinking polluted water, they get into our bodies, they can penetrate the skin. And once they are in the body, they have a half-life of 8 years. You can imagine that over the course of a life, the concentrations of these chemicals accumulate more and more. And as we have heard, some of them are very clearly carcinogenic. There is proof of that. And for others, there is very strong evidence that they are linked to certain cancers. We heard about prostate and testicular cancers, but there are also others, for example, kidney cancers and many other diseases which are caused by these group of chemicals. The problem here is that they are really everywhere and that it's a big market. It's also quite a significant profit margin when they are produced. On the other hand, there are also very often, yeah, very well-known cases of pollution of PFAS, of earth or of drinking water, and the often the producers of these chemicals are then asked really to compensate the victims of these pollutions. And they are not only in the US, of course, also in Europe, in Germany, in Italy. There are well-known examples of these large environmental catastrophes. So, what did the EU then do about this? So, we heard about REACH, that is a legislation which covers chemicals, but the problem is that some of these PFAS, especially when they are involved in medical products or in pesticides, that they are not really covered under this REACH legislation. And from the about 10,000 registered substances, at least about 100 are really very clear carcinogenic ones. The problem here is that because there are so many molecules, that the information on most of them is actually not there. So we don't really know what they are doing. And that is also a big, big problem. There was an estimation from the Nordic Council a few years ago that PFAS-related health environmental impact is about 50 to 80 billion annually, which is a large, large sum, of course. Again, highlighting the very urgent issue here that we all have to address, that we have to reduce the amount of produced PFAS. So, because of all this, in 2019, the European Council asked the Commission for an action plan so that all the PFAS can be eliminated, which are not considered essential. And following that, about five countries, the Nordic states, but also Germany and the Netherlands, then submitted a proposal to ban all PFAS. However, that includes also exceptions for certain products like medicines and pesticides where these PFAS are contained. So the European Chemicals Agency then published that proposal about 2 years ago, and they are still working to complete their scientific evaluation of the proposed restrictions, and that work should be done by the end of next year. So you can see that these are long, long processes. Just to speed it up, really, what ECL also did was published a policy paper earlier this year. You can find that also on the ECL website, asking for several things. First of all, that not all these PFAS molecules are treated individually, but also really that they are considered as one big group of dangerous chemicals, which should be restricted, because otherwise things would take really far, far too long. And the other important thing is that all PFAS related products should be considered. So there shouldn't be many exceptions anymore. And if there are still exemptions necessary because there are no alternatives, then these exceptions need to be really time limited, as minimal as possible. Yeah, we, in addition to the policy paper, also produced a webinar, I think in May this year. Again, you can find this on the ECL website, where two of our experts from our national members looked at the issues and explained in detail why these chemicals are very, very dangerous. And finally, there is a PFAS manifesto, which is already signed by 115 organizations, of course, including HEAL and ECL. And on the one hand, we are asking really to stop producing the PFAS in the EU. And on the other hand, we are also asking that the EU takes measures to remove the existing pollutions in water and in soil and also compensate the populations living in these areas. And I want to finish with that. Thank you very much.
Thank you very much, Dr. Fecke, for presenting in such a short space of time as well, all of the work that you're doing around cancer prevention, but particularly around environmental determinants and chemicals. I could ask Dr. Canarelli to turn on her camera as well. And we have a few, thank you everybody for all the questions you've been putting into the question and answer. We have about 5 more minutes we can take to look at some of the questions, and we will be making this recording and the slides that's available on our websites after the meeting. So you will have access to that afterwards. So I hope that will be a useful resource. So I have one question here. Let me just see now, it went away. I had it a minute ago. Yolanda, that's very weird. Okay, I'm just going to go to another place where it was from Johan Garcia, and he or she is asking a question about the aspects about intergenerational exposure and how to know how it's done over the lifetime and what kind of things can be done so that either the parent or the male or the female are not yeah.
So as I said, so there is the evidence related to the fact that maternal exposure has been associated with increased risk of testicular cancer. So for sure we need to reduce the exposure during during the pregnancy, because this is a really sensitive window. But this is not the only, of course, sensitive window. Something that is not considered and it is even overlooked is the pre-conceptional window, basically, because and particularly this is important for the father, because the sperm cycle basically happens every 72 days. Therefore, the exposure during those 72 days has an impact, on a direct impact actually, on the genetics, on the fetus, and on the baby himself. So it's important to reduce the exposure even during this window. Not we don't know the impact yet on the specific health outcomes, basically, because there are not evidence on testicular cancer itself, but there is evidence regarding, for example, the risk of developing diabetes or of developing neurodevelopmental disorder, which is something, autism. So we are talking something that is sensitive, very sensitive, and there is emerging evidence that is starting to link paternal health during periconceptional window and risk of neurodevelopmental disease in the baby. So this is another thing that we need to consider. And of course, the mother do not have to be blamed, basically, because the same care, we need to apply to the father himself, because the babies are conceived within the two parents, not only, of course, the mother herself, the father has a role as well.
Thank you very much. I have a question for Dr. Fecke. It's around how we can get the cancer establishment or the Cancer Society to accept and integrate better the environmental and occupational risk factors for cancer. So you had some experience with that. So I don't know if you have any recommendations on that.
Yeah, of course, we need to just publish the dangers here. I think everybody now knows that pollution is everywhere and causes diseases. We will do our part in the European Parliament, and yeah, working with our national societies, but really everybody should do that. People should go to schools and talk to children and really go there. And the more people make these things public, the better it is. It's a growing problem, and it's maybe not the number one risk factor for cancer, but it's a very, very important one as well. So we should all still work on it.
Okay, thank you very much. I'm going to have one last question. I know we're running a little bit out of time, and we will look at some of these questions that are here and see if we can get back some answers to people who've asked them from the report itself or from our speakers at a later date. So we will try to do that as well. This one is more of a scientific or technical issue. On EDCs, they say EDCs needs to be tested for estrogenic, androgenic, and thyroid-like compounds in complex cocktails. So should not effect-based methods for these EAT active compounds be more promoted? I don't know if you have some experience in that.
Yeah, so I totally agree with the implication basically of the question. And this is the second question that I can see that targets the issue related to the cocktail, because a technical issue is and something that influence directly the policy, how we make the policies, how should we measure the cocktail effect. So I would like to say that the bio monitoring studies that I mentioned provided evidence for the cocktail effect. So this is something that policymakers need to acknowledge and consider and include in the policies as well. Second, but it is more for research, but in the future may be helpful, there is the concept of the exposome that simply basically try to merge the overall exposure to chemicals, but also to harmful lifestyle, diets, smoking. Okay, so on one hand, on the other hand, merge this exposure to the endogenous susceptibility that each person has to specific chemicals or specific diets, because we may be exposed similarly, but not all will develop the same consequences on health, because all of us has a different genetics and also a different predisposition. So this, I think, in the future will be the key to really help and to really have a measurable, outcome or something that allow us to really quantify the risk of the person and the overall exposure. So I hope I replied.
Okay, thank you. And I mean, that's really interesting. You're talking about the exposome. I mean, there is many EU projects. HEAL's been part of some of them, looking at human health in the exposome. One of them was on early life exposure and mothers and children. That's called Athlete. And now there is an international exposome network, and they're going to be having a big conference to look at how we can do this globally as well in April next year in Spain. So that's something to definitely we can keep informing on and be using that. And then hopefully we can also be looking at the MEPs against cancer and the work that ECL is doing to actually bring this issue as well towards members of the European Parliament as an important factor in supporting evidence-based policy making. So I'm going to, end this webinar, but I also wanted just to again thank both of you for really such amazing presentations. It was so much information, but so clearly presented. I can tell from a lot of really good questions, and also thanks from cancer societies, from all types of groups who are really appreciating this information. And we will be sending out in the next 2 days the recording. and the slide sets. So hopefully people can continue to look at this. And I'm going to wish everybody and thank all our listeners for being on the call today, and all of the HEAL team behind the scenes who's made this possible. Thank you very much. And we look forward to continue discussing this issue as the REACH revision hopefully comes out in the next month or two, and we can be looking at how this evidence and others can be used to make sure it has a health focus. Thank you, everybody.